Hi, folks. Hang on. We're gonna allow Joy Prudick in here in our meeting. So we're admitting Joy from the St. Luke's system, and she'll be joining us in just a second. Hi, Joy. I'm glad you could join us here. And with me today is Joy Prudick from the St. Luke's Hospital affiliation, and also Dr. Julie Lyons. And as I spoke as superintendent of the Blaine County School District, my name is Fritz Peters. And as I spoke to many medical professionals across the community, we wanted to create a recorded session talking to a medical professional about the vaccine and all the questions people have. And many people encouraged me to speak with Dr. Lyons. So we're here today to ask her some questions and use this format to inform and to help people understand the process of how to get a vaccine, why you should get a vaccine, what are some of the concerns, the possible side effects, and anything else that we can create during our conversation with Dr. Lyons. So first and foremost, thank you both for joining me. And I know your time has been so valuable. And I just want to say that healthcare professionals across the country and also the world, we just owe you so much. You have been incredible essential workers throughout this whole pandemic, and your work has been brilliant, and you really are our heroes. So thank you so much for that, just to kick off. So first and foremost, Dr. Lyons, could you just introduce yourself in this format and talk a little bit about your background and the work you've done with the school district as well?
Well, also teachers are the frontline workers too, so we appreciate you.
Thank you so much.
Yeah, so I'm Dr. Julie Lyons. I've been practicing here for 11 years at St. Luke's Family Medicine. I grew up and trained on the East Coast and went to college at Brown and went to medical school in Oregon. Before I went to medical school, I actually used to be a high school science teacher. So come from that background. It was the hardest job I ever had though. And over the, months of the pandemic, obviously it's been a huge learning curve for all of us. We certainly don't get trained about a pandemic in medical school or residency. And a lot of new knowledge had to take place in order for us to learn how to treat COVID and now ultimately learn how to prevent COVID. On a side note, I've also been working with the school nurses pretty much weekly since the fall in terms of helping triage and helping you guys define your policies and making sure that we're doing the right things for the kids. So that's been a rewarding experience for all of us.
Great, well, thank you so much. So let me just start off by, how is the vaccination process going in Blaine County and specifically at St. Luke's? And what have you seen in terms of the actual distribution of the vaccine, and how are things going in general in the county, would you say?
I've been pleasantly surprised at the rollout. We are now 29 days into our vaccination program in the Valley. I know that because I just got my booster yesterday. And I feel like St. Luke's has really done a great job coming to the table, getting organized and getting the process figured out. So we opened it up to teachers probably sooner than I anticipated, and I was really excited to hear that. I figured the teachers might be in February, so the fact that a number of teachers have already gotten the vaccine really made me excited.
And when the vaccine is coming out, I want to make sure that people understand about when you get the vaccine. Is there a bit of time there after getting the vaccine where you get the effectiveness of the full vaccine? So like, you just got your booster, which means your second shot, correct?
Yeah, so the data is actually pretty fascinating. It looks like even with one vaccine by day 14 in the Moderna vaccine, which is the one we're providing here, you have almost 80% protection.
Wow.
So it is appearing to be a very highly effective vaccine. And then when you get to the booster, that raises your protection to 94.5%. There are almost no other vaccines that look this good. Now, obviously, more data is going to be collected to kind of fine tune the actual numbers, but I see the numbers only, either staying the same or improving. Um, the one uncertainty that nobody can answer is how long does the vaccine last for? How long does your immunity last for? But I think it's very certain that it provides protection, especially from severe disease, which is hospitalization or the need for oxygen, which if you, kind of look at the big picture, that's our main target that we're trying to prevent in the whole pandemic, is to not overload the healthcare systems with hospitalizations.
Exactly. So when someone gets their first shot within 14 days, that's when that incredibly high effectiveness rate kicks in. So there is a little bit of a waiting period. So people that get the vaccine should not just all of a sudden assume, okay, I got the vaccine and tomorrow I can forget about all the protocols, right? They should maintain and continue with their safety protocols of masking and social distancing and hand washing and other standard protocols that we all should be following. Is that correct?
Yeah, absolutely. We know, I like to tell my patients that the vaccine will protect yourself from serious disease, but you still need to protect others from serious disease by doing your social distancing and your masking. And, it's very clear that social distancing and masking has made a difference. I always use the example that I always feel safer going to work than I do going anywhere else right now, because most of us in the healthcare system have been working around COVID patients for many, many months now, and not getting the disease because of these preventative measures. So the combination of the two, I think, is the key until we really learn more about when we can stop those social distancing protocols.
So when you got your first vaccine, and then when you got your second vaccine, your booster shot, did you yourself, just as an individual, and you can answer this as if you want to, but did you have some side effects, or are there some common side effects that are attributed to getting the vaccine that we're starting to see as a trend, or universally or internationally?
Yeah, I mean, the most common side effects reported are the most common side effects for any vaccine. So that's headache and body aches and feeling like you're getting the flu. I will say that personally, I think I had more side effects than maybe some of my partners, and especially my husband, who's a nurse. And last night I spent the night kind of having that flu-like feeling throughout the night with a headache. Obviously, taking ibuprofen was a miracle and helped me feel better after. But really, at the end of the day, that is the most common side effect. And compared to 10 to 14 days or 21 days of the disease of coronavirus, especially severe disease, I'll take a bad night. There have been a few more serious reported effects. I mean, a lot of it has been on the media. There's been a handful of people that have had anaphylaxis within that 30-minute period after the shot. There have been no cases of that reported in our town that I'm aware of. And again, that number is 5 cases out of how many doses have we given? 12 million. So really, less than 1 in a million chance that you're gonna have an anaphylactic reaction. There have been a few cases of people who develop true fevers after the vaccine, like 102, 103. Those tend to be temporary. And again, that's not the most common side effect. The most common side effect is body aches or nothing, like I said.
Great. So can you tell us a little bit about your understanding of why this vaccine was developed so quickly? Early on when COVID was really hitting in the spring, a lot of very knowledgeable people were saying, oh, it's going to be 2 years and in a year and a half at the earliest in 2022. And so, it really was astonishing to hear that the vaccine was developed, and when they started really talking about it and saying it's going to come before Christmas, and it was hard to believe initially. And then when it started coming out and the effectiveness rates were so alarmingly high, it was great news. So can you just tell us a little bit about why you think the vaccine came about so quickly?
Yeah, I mean, I think the new technology of using mRNA as your vaccine, it's a much easier technology to manufacture, is my understanding. So the mRNA of the virus is the code for the spike protein that we see on the coronavirus. And so they basically put that code into a little fat globule, And that fat globule is then injected into your muscle cell. In the muscle cell, the ribosomes, which are the little dots that are your factories, they pick up the code, they translate the code, and they make the spike protein. There's been a lot of fear that it might, mutate your own cells, but it does not actually enter the nucleus of your own cells. So we're just using the little factories to produce those spike proteins, and those spike proteins then, when you get the disease, if you have the coronavirus in your nasal passageway, they are able to attack it right away. But I think the speed of the rollout, is impressive. But I think some of it is that my understanding is that the production of mRNA is actually easier than maybe using dead or attenuated vaccines. That was my cat.
Yeah, your cat's beautiful. I got to meet. It is a him, right? I got to meet him earlier. So
yeah, she.
Oh, she.
Cool.
Okay. Well, she's good. She's our first audience member. I can say that. So tell me about why students are not being vaccinated, or people under 18. And I'm not sure if it's associated with that they shouldn't have it, or just because they're not so much at risk and we're prioritizing, older generations. But, I've heard very clearly that this would not be a vaccine for students. And why is that?
I think there's a few reasons behind that. I think one is sort of the ethics of involving children in a study of a new vaccine. So getting the permission behind that obviously would be a little more challenging than just using adults. Two is obviously that we knew right off the bat that the disease is more severe in adults than children. So the target really was the adults from that perspective. The Pfizer vaccine is now enrolling kids 12 and up, and Moderna is 18 and up, but I expect that we'll start moving the vaccine down in age group. And again, the big goal is trying to prevent the spread of the disease amongst each other. And so therefore, the more immunity you have, the less spread you're going to have. So I foresee it eventually being available to children of some age.
So if I am a teacher in the school district and I'm on the fence about taking the vaccine, what would you say to that person personally? Professionally.
I've been telling my patients, I think it's pretty normal to be a little skeptical of something that has come out so quickly. I felt skeptical myself. But I really, once you look at the data, there's some great resources out there if you're want to make sure that the data is good. I felt like that really helped sell the vaccine to me. I mean, we're not looking at something that's, as good as a placebo. We're looking at something that is much better than a placebo. I think that one thing that helped me also is on a social media group that I'm on with other physician female moms, and just huge discussion around the country with lots of specialists weighing in terms of the vaccine safety, and just hearing all these physicians collaborate on their views. It's really helped me feel more solid as well too. So I always say education is key, and I think there's a lot of good to learn about this vaccine that I think can make people feel safe about it. And as educators, we know that kids do benefit, populations do benefit from vaccines. That's why we have such a healthy population in general and don't see those serious diseases anymore. So looking at history, I think, can remind us about how important vaccines really are.
So let me ask you this, from a longer viewpoint, for the pandemic itself, what kind of level of vaccination will we need to see throughout our entire population? Not only throughout the world, but in America and then locally. But is there a point where you can kind of reach a level where the vaccine is just no longer, the virus is just no longer a threat to a community? And of course, there's always going to be dangers of it, but is there a percentage of the population that hopefully can be vaccinated to the point of where we really can have a new normal, where maybe we can start actually hugging people again and living our lives a little bit more And having full capacity on the chairlift would be so great. I just plug in for that. But is there a percentage of the population, if they were vaccinated, that you could really start to move forward and possibly put the pandemic as a whole a little bit in our rear view?
Yeah, I mean, I think people say that probably the bare minimum of herd immunity is at least 70% of your population having the disease or the vaccine. But I think our goal would be to get to 95%. And different experts may have slightly different takes on that number, but you really need the majority of your population to have the mass benefit.
So talk a little bit about the variants, because we're hearing on the news quite a bit about the variants from the UK and now other variants that are happening. And I read one article that was titled "Coronavirus" or the COVID-19 is changing before our eyes. Is the Moderna and the other vaccines, are they like are they completely covering all the variants as well, or do we have to worry about a variant being much stronger and the vaccine not being effective?
Yeah, I think it's probably too soon to know for sure. I think the new variant from the UK shows, that increased contagious rate, but it may not be affecting how the vaccine itself works. I think that maybe some more concern is coming from the variant of South Africa. But again, I think we just don't know how that will affect the vaccine efficacy. I don't think it'll ever, you know, I hope that it won't be like the flu shot where your efficacy can go down to 30 to 50% per year, just based on how good our initial numbers look, and the technology behind it. I feel like that would be unlikely. But I think we'll obviously know more as more gets studied on these strains.
So, as a historian, I taught history for years, and I still read quite a bit about history. And I've read some, books recently about the smallpox and polio and things like that. And the vaccines at that time were considered to be just, amazing, like just incredible to change the world platform with these viruses and these diseases. And there was a point where we really eradicated smallpox as an entire human population. And then there was a little bit of an outcropping of it a few years ago, but basically we eradicated smallpox as such a critical, crippling virus across the world. And do you see that happening with the coronavirus if we get this vaccination and if enough people do it?
Yeah, I mean, I certainly think that the burden of the disease is going to be decreased. I think probably there's going to be a natural evolutionary immunology piece too as well, where hopefully ultimately this does become just a common cold, but because it's such a new virus to our immune systems, and we have not had contact with the virus like this before, I think it's certainly doing more devastation than a typical coronavirus does. So I think between the vaccine and hopefully our bodies learning how to adapt to a new virus, we will get to a better place in the not so distant future.
That's encouraging. So my wife and I both had the virus very early on in the spring, and my wife had it particularly badly, and it was a very trying and scary time in our family. And then we still have antibodies from some of our tests that we've done and our blood tests. And what would you say to someone that has antibodies and says, I've got the antibodies already, I'm good to go? Because I've heard that the antibodies themselves are nothing in terms of preventative effectiveness compared to the vaccine. Is that correct?
Yeah, I mean, we just don't know how long those antibodies last, and I've had several patients, have had who had the disease in March now no longer have antibodies, and I think some of that may be a different mechanism of immunicity, but no, I think the recommendation, and we're encouraging, even if you did have coronavirus, we want you to get that vaccine. Give yourself that extra immunity. The studies, both from Moderna and Pfizer, did have a few people who had COVID and then got the vaccine. And compared to the people who had COVID and didn't get the vaccine, there was certainly, again, efficacy in the vaccine for preventing the second round of COVID. So we absolutely recommend it. And there are a few situations where if patients want to defer it for 90 days from their vaccine or from their initial COVID disease, I guess that could be a reasonable approach. Although we say, as soon as you're well, get the vaccine, give yourself the extra immunity. But beyond 90 days, I don't think that we can safely say that you are immune and protected just from the disease itself.
Great. So we do have some staff members, and I'm sure community members as well, that are either pregnant or trying to get pregnant or are nursing. Is there any concern with moms who are pregnant or are nursing at that time, whether they should get a vaccine or not? Has there been any data on that you could report?
Yeah, so all the major healthcare organizations in the country and across the world have been wanting us to promote the vaccine in both pregnancy and lactation. And particular, the reason is that there is now data showing that those who are pregnant who get COVID tend to do worse than when you're not pregnant.
Wow.
So again, trying to prevent that serious disease, we want you to get the vaccine. I've had several friends and colleagues who've gotten the vaccine while pregnant. If there's a big push on social media to show pictures of the pregnant woman getting the vaccine, and lots and lots of doctors are getting it while pregnant. So I feel like that, there only more data will show up from that. In fact, one of my colleagues got her vaccine while she was in labor. So,
oh my gosh,
talk about hardcore.
Probably the needle didn't hurt as much during labor.
Yeah.
that was nothing compared to labor.
Yeah.
So is there anything else you'd like to add just from an overall perspective, or maybe a question that I didn't ask?
No, I mean, I think you touched on all the main issues. I think just from the emotional standpoint, getting our vaccines was such a wonderfully uplifting experience. When as healthcare workers came in last month, I mean, we had so much fun in that room, just hooting and hollering and feeling like we were making a huge step toward in the right direction. And I heard from my colleague who was working the urgent care clinic that the same thing happened over the weekend. This weekend, when the teachers came in, there was just a parade of teachers and everybody was feeling so positive and excited. So it really is a meaningful experience. We want you to, document your vaccine, put it on social media, tell us about how it went for you. I think it's from the ground up kind of conversation, and the more we see each other getting the vaccine, I think the more we'll believe in it. So, you can feel assured that the majority of your healthcare workers in this town have gotten it and have survived it and are excited about it. So I hope that we can continue that movement in the right direction.
And just to clarify, once you get your first dose, it's automatically, there's another appointment made for you, correct? Where you get your booster.
Exactly. Yeah, you'll be given your booster appointment on the way out the door, and everything. In order to get your vaccine, you do need to have access to MyChart. So that's the easiest way to sign up and get your appointment. So we do recommend that everybody who is a patient or ever has been a patient or is not, even if you're not a patient, that you get MyChart available. If you do not have access to MyChart, we also have a hotline number you can call and sign up for the vaccine that way.
Great. Yeah, Joy just mentioned that. So Joy, could you add anything for us just about the whole St. Luke's system and how things are going on your end, and any other information that we might need?
Absolutely, and I want to thank you both. Just an excellent conversation and so much information that people have these very common questions. And in terms of the appointments and the scheduling, I've been volunteering at the clinics, and we've been working out any kinks, and it's running smoother, and we're getting hundreds of people vaccinated at these clinics. It's very exciting. And we know that there's also, I want people to know that if you do go into MyChart and you don't see a date and a time available when your tier is open, please continue to go back and look because we are always diligently working to add additional appointments. Also, I just learned this morning that my chart actually does have a toggle that you can change to Spanish, and you can make your appointment that way. Our build team is looking at making it simpler and working on flyers and resources with screen grabs so that it can be even more clear how you make your appointment. We're going to be working on additional access, potentially doing some mass vaccination events in the community. And we look forward to being able to roll that out. We again, like Julie said, we would really like to hear and see documented on social media that you got your vaccine and your why of receiving the vaccine. I just think it's really so, it's a wonderful thing to see this light at the end of the tunnel, and we have a ways to go, but this community is founded on taking care of each other. And I think that's just a really wonderful thing about living here, and that's why you should get your vaccine.
Well, thank you so much, Joy. And we have the chance here to have social media actually be something that's positive in our lives as educators for a change, because we do have fun with social media. So our time is about up, but I want to really thank both of you so much from the bottom of my heart, because I just have such a great, wonderful feeling about what you folks are doing, but also I have some empathy for what you folks have been through. There have been times when I've been hearing about how the capacity at the hospital has been so overwhelmed, and we all have to take this seriously, and this vaccine really is kind of an amazing miracle. So I really hope that we can push forward with our staff and educate and encourage and make sure people, if they do have some questions, they can keep asking, and I hope this video and this platform can help with that. So Dr. Lyons and Joy, I really appreciate both of you so much. And Julie, your cat is stunning and beautiful. What a nice pickup in your life.
Sorry about the noise.
No, that was part of the plan. We worked it out. She and I worked it out. We wanted that to be part of the video. So yeah, there we go. What a perfect ending.
Next time she'll get locked out.
Hey, well, I'm a Leo, so we have some symbiotic things going here. Thank you both so much, and I'll end on that note, and just I really appreciate your time, because I know how busy you both are.
Well, thank you.
And St. Luke's has just been invaluable. And one of our admin assistants actually did create some screen captures of how to log on, and we sent it to our whole staff. And I think we've really been pushing it out to the staff. So hopefully we can get more kids back in school, and you guys will be a huge ingredient in us being able to get more kids back in school safely and the right way. So thank you all so much, and I appreciate your time and efforts.
You're welcome. Bye.
Yeah,
Bye-bye.
thank you. Bye.